everybody else that's out there. Second, we avoid crowds and gatherings no matter what. If you got to go to the grocery store, you got to go to the hardware store and there's a crowd, come back later. So now I get a lot of complaints and we follow up on them about crowds at these stores. Part of that fault might be the stores, but the other part is everybody in there that's a part of the crowd. We have to take that personal responsibility to know that our actions matter, and even somebody else's actions that create that crowd. We got to be bigger and we got to be better, and we got to leave at that point to make sure that that coronavirus isn't spreading. Number 3, we practice social distancing. We're out, we're walking the dog. There's somebody else that's running or walking the dog coming by. You make sure that there's 6 feet of distance. You could smile, you could say hi, and you should. We don't want to stop being the good people that we are, but otherwise we keep going. Number 4, knowing when to seek care. As our cases are escalating, and they are escalating, we have to make sure that we can serve our resources, our healthcare capacity, even as we're working to increase it. So knowing when to seek care is so important. We put that slide up and then we can come back. I'm helped today by James and by Virginia. So remember, if you are healthy but just nervous, call the coronavirus hotline. Don't call your primary care physician. Don't go to a facility. Know that we have to preserve those healthcare resources. Someone that's actually sick needs them. If you are sick but would have not otherwise sought care, call your primary care physician. And if you are sick with anything else, but don't need immediate attention, make sure you use telehealth if it is at all possible. That protects you from going somewhere where you could contract the virus, and it makes sure that we have the beds, the ICUs, everything else available that we're going to need. But, and I always want to make sure we hit this, if you are really sick and you need help or you are injured, make sure you go to one of our healthcare facilities. If you really need to be seen by a doctor, but you're scared about the coronavirus, go anyways. Make sure that you are getting the help you need. We don't want to lose people to other things because they're scared to go to that healthcare facility. If we go back to our 10, number 5 is kycovid19.ky.gov. Every day we see different rumors, and as the fear and the anxiety increases, maybe as we've just been at this for a long time, that we get something new, we see something new on social media, folks. kycovid19.ky.gov is where you get your information. Wash your hands with soap and water, 20 seconds. Do it multiple times per day. Disinfect your home and your workspace. If you can't get the disinfectant, use the 1-100 bleach solution. Apply for benefits. This is unemployment. This is Medicaid. Make sure you have what you need. You getting on Medicaid is going to help our hospitals when they are helping you. We need everybody to have health care coverage. And while I know there have been some stumbling blocks in unemployment, and in fact, our unemployment claims by percentage have increased within the top 10, I believe, in the country. But you know what? I'm proud of that because that means that you are applying. It means that we're going to help you to get through this. It means that we're going to make sure that our people, because almost every other state is going through what we are, but we are trying to reach out and to make sure that you are covered. We want to make sure that we all get through this. And we all get through it together. Prioritizing your mental health. You know, we talked about schools now being close to in-class activity through at least the end of the month. Every other restriction is going to be in place until at least the end of the month. So we know we got to be strong. We know we've got to preserve our mental health, and we know that we're going to be at this for weeks or months. And so make sure each day you're doing things that help your physical, emotional, and mental health. Do not travel anywhere. We've put a lot of restrictions on interstate travel. Don't travel anywhere. The only reason you should be going anywhere is to get supplies or to go to work if you're going to work right now. Otherwise, don't travel at all. Finally, report noncompliance. So I always talk about the 10 steps plus 1, fill out your census. You have time So we're going to have to rebuild our economy after this. I'm committed to it. I'm actually looking forward to it, because when we're doing that, it means we are beyond this COVID crisis. It means we are beyond the challenge of our times and the test of our humanity that I know we're up for and we are going to pass. I look forward to the time that we're going to be able to do that. But filling out your census is going to help us to rebuild our economy. The other thing that I've asked is, because all of this is our duty. It's because for the first time in my lifetime, every single Kentuckian's actions impact other people. Every single Kentuckian that doesn't follow social distancing puts other Kentuckians at risk. People they probably don't know, but people who are loved by their community and by their families. And so what I've asked is, more than anything, that we get out there and that we model the behavior that we want to see, that we celebrate doing our duty, that we celebrate social distancing, which sounds strange. But when it's something we need everybody to do, when it's what we are called upon by our country and by our Commonwealth, when it is the thing that is going to save lives, then I want us to celebrate when we're doing the right things. So we've asked that you fill up social media with it, and let's look at the hashtags that we've asked people to use: Team Kentucky, Together Kentucky, Patriot, and Healthy at Home. So James, let's look at a little bit of what we've got today. All right, so our veterinarians around the state are helping. They're sending PPE, anything that they don't need. This is Rood and Riddle, which is a great surgery center. Look at some of those numbers. Those are really going to help our frontline healthcare workers. Healthy at Home, finding constructive, productive things for our kids to do. You know, I read an article today, trying to be a good dad, trying to take a couple extra minutes on things that you can do to help your kids get through this. And one of the suggestions was so simple and so easy that, you know, I felt a little guilty having not thought about it. It's find something that your kids are passionate about and start sharing that interest. Find something that they really like to do and you get into it too. It's an amazing way to spend that time together. A really good tip. Okay, these are two couples that have postponed their weddings. I know we're asking for a lot of sacrifice. Weddings and funerals are two of the hardest. They are two times when families come together, but we simply cannot have those crowds right now. We appreciate these two couples modeling the fact that they're pushing it off because they know that they're helping and they're saving people. And I love all around our communities, everywhere across Kentucky, we see people coming together and spreading the message. More united than ever, more committed than ever. No Democrats, no Republicans, no divisions, just us as Kentuckians and as Americans versus this coronavirus. We are truly united. And this is one that my wife Brittany sent. You know, this sidewalk chalk that we see coming up now more than ever. We see the messages that our kids are internalizing. We see the beauty and the joy that they can take in doing some of the simple things. They understand why we're doing what we're doing, and so should we. And this was just a neat thing people put together. It's actually a video, but we have trouble showing it. You know, we're lighting our houses up green. We're lighting the Capitol up green. We're lighting the mansion up green to recognize and to show compassion for the families that have lost loved ones. We ask every night that we lose loved ones that you turn on your green lights, and we're seeing more and more and more of them all over the Commonwealth. I see people painting light bulbs green that can't find ways to order them. It's a special way, along with ringing your bells, any bells at 10 a.m. every day, that people know that we care about them and they are not alone. Even with us having to be apart, we have got to make sure that we keep that compassion. Because if we're facing a test of humanity, which is the way we are, what we're doing, we have to find ways to be able to express it. We also have a video today. Is that next, James? a video today. This is from Joe and Jessica Adele. Jessica was the 2014 Miss Softball Kentucky. If you can pause it just for a second. Let me tell people what it is.
Through the web. Teenagers and other people who might not think that
we'll restart it in a second. And Joe was Kentucky's Mr. Baseball in 2017, was one of the nation's top baseball prospects at Ballard High School, was picked in the top 10 of the Major League Baseball draft, and we want to thank the Kentucky Department of Education for helping them to send this message to make sure that people are doing the social distancing and participating the way that we need them to.
Guys, Joe Adele here.
And I'm Jessica Adele. We came on here tonight to let you guys know the importance of social distancing. We need to take it more serious now than ever. There are so many other ways to emotionally connect with your friends and family through the web. Teenagers and other people who might not think that they can get the virus, please stay at home so you don't spread it. And parents, make sure you're enforcing that everyone stays at home. This is not a joke.
No, stay at home, everyone. We're going to show you a couple of things that we've been doing during this time of social distance.
We appreciate the Adeles, and it's just another example of making sure that we stay healthy in many different ways. I mean, these are two incredible athletes. He is a professional athlete, all of us in the same boat, all of us healthy at home, finding different ways to spend our time in the most productive, healthy ways that are possible. All right, so we have been talking about how important what we do is. We've been talking about how these next weeks and the next month are absolutely critical to flattening the curve, but I want to talk about what flattening the curve means. Now, it means not only making sure we have the healthcare capacity that we need, but it also means directly saving lives. I want to start with the Philadelphia St. Louis slide, if I can, James, because we show this a lot. And we showed about what social distancing can do specifically to help flatten the curve for healthcare. But I do want to point out that this slide is about people that were lost during the Spanish flu. And if you look at the overall numbers as they were hit, it shows that social distancing, that how much we follow these rules truly means that we save people that we otherwise would have lost. That by making sure that we can flatten it out, that we not only have the beds, the resources available, but that we have more of our brothers and sisters, our parents, our friends that are here with us as we get through this. And as we enter what's going to be a beautiful weekend where we're going to want to get out and we're going to see other people, I do just want to remind people that this social distancing isn't something that we're simply asking people to do, and it's the rules, and we hope that you follow them. It's truly what you do to make sure that we don't lose a life somewhere else. I want to show a couple projections, and one will be new today. Let's show the White House's projection again about the United States. We showed this a couple days ago just to give you an idea conceptually at what the White House was talking about. So this was the graph that they showed, and what they showed is with social distancing, by following the rules, and this would be the whole country, and this would be, again, we think this is optimistic for the entire country, the difference. And if we do what we need to do, and social distancing is entirely in our control. It's not PPE, it's not number of beds, it's not number of kits. It's entirely in our control. You look and the country, and that could be the difference in almost 2 million people that are here with us that otherwise wouldn't be. So when we put this on the state level the other day, if you could show that first one. Yep, this will do it. So this is what we showed, and these were the White House's numbers, James, or this is the new projection. Let's go back to the other one real quick. And we'll show you this one in a minute. Okay, so what we showed you the other day was if you took the White House's projections and you compared them to Kentucky, what you'd be looking at. And we showed you that it was really between about 1 and 2,000 deaths. And we all said we wanted to do better than that. But I also said that this is a little bit more optimistic than what many of our projections had. So this is a separate projection. It's one of the ones, COVID Act Now, that you could find on the internet. Again, they are only projections. This one showed something a little bit different. This one showed with no intervention, we'd be looking at 21 to 29,000. We've already taken steps. That's not going to happen. But with intervention, we'd be looking at significantly smaller. Wait, this was the White House's one. So let's show the new one. Technology. So this is from KY COVID. This is from COVID Act Now that's out there. So this one has slightly different projections. As you can see, none of us are sure. This one is a little less optimistic. This said if we didn't do anything, the results would be about 5,000 people worse. But this one first says, okay, so we're doing social distancing, but what if we don't do it well? What if we get out and you know, on a nice weekend, we don't follow the rules? What if if we're in the grocery store, what if we use it as a social hour? Well, what if some of us just don't think it applies to us? And look at that. That is a result none of us want. It's saying that just having the rules and the regulations in place don't do a lot unless we internalize it and we follow it. And that's tough. That's really tough. That's a whole lot of people that we love and we care about. But they have another projection too that I want you to see. That if we do this right, and this isn't with us passing any more restrictions, this is based on what we have right now. If we can keep this up, if we believe that it is our patriotic duty, our part of passing the test of humanity, to strictly follow the guidelines and the social distancing that's out there, look at that. We can save in the very least 11,000 people under this model than if we don't. 11,000. I hope that motivates folks. I know this can be scary. It is. This whole thing's scary, right? It creates anxiety, and it's the reason that I say breathe. It makes me need to breathe. But I just want to show you at the start of a beautiful weekend, of a beautiful spring, of things where we want to get out and do different things. This is how important this is. That in this model, and again, it's just a model, I hope to do better than the strict compliance, right? But just us doing our duty could mean the difference between, if you look at it, 11,000 or even 45,000. These are Kentuckians. They're counting on us. So let's make sure that we do what we need to do to protect those that are around us. This is our calling. This is our time. Other generations went into wars, went into other challenges with even more than this on the line. But what's being asked of us is less. Now, it's tough, but what's being asked of us is ultimately just to follow rules, to stay apart from each other, but look at the good that it can do if we all follow that. Now, as the days go by, I'm going to show you some other projections too. I believe in being as transparent as I can, and many others have different projections out there. I will tell you, that this strict compliance is one of the best projections for us. So let's make sure that we can do everything that we can do to protect those that are around us. And we're already seeing, with Kentucky being one of the top states in heart disease and lung cancer and diabetes, those are the pre-existing conditions that this virus comes for. Knowing that we have so many people with it, we got to remember this slide and know that people are truly counting on us. So no public gatherings, right? I hope anybody out there that is still holding one, any type of meeting or anything else, looks at this and says, if they do it, they will be one of the reasons that we're not in the lower part, but trending towards the upper part. We have seen through examples, and I've had to make examples, and I haven't wanted to, but I've had to, what just one kind of violation of these rules and people getting together, doing something that they can't, can have huge impacts on a community. So let's make sure that we are meeting our calling, that we are passing that test of humanity, because other people are really counting on us. So the three ways that we go about addressing this crisis and this virus are, number one, social distancing. That is all this slide is about. That's it. This is how well we do, totally in our control. We're not relying on the federal government or anything they send to us. We're not relying on anything other than us. This is our challenge, it's our calling, and if we do it, look at the results that it can give. But our three approaches are social distancing, are increasing our healthcare capacity, and testing. And let's show our healthcare capacity. Again, there are three areas in that are so important. This was the baseline that we started with. It's our number of hospital beds, and we're working through major planning with our healthcare providers. Right now, I believe our plans can get us north of 25,000 beds, a significant increase that is here. It's why UK's announcement of 400 additional beds if needed in Nutter Fieldhouse is really important. It's why what we're going to do at the fairgrounds, which is going to take us a little time to build out, is very important. It's why what every hospital system is going to do to build out is very important, and that's not even included in those numbers. Our goal between now and when it's needed is to try to increase this capacity as much as we can. The other kind of limiting factor on some of this is our amount of personal protective equipment. We talk about that every day too. Those are the N95 masks, the surgical masks, the gloves, the gowns, everything that is needed. And we got three different ways we go about that. Number one, we try to buy it. It's really hard. The federal government buys most all of it. Number two, we try to manufacture it. And we're out there working with Kentucky companies trying to do that. But number three is you donate it. We still have a lot of it out there. And so we want to make it just a little bit easier. We're asking anybody who has PPE to donate to try to do it through a central location. This is our new number, which is 833-GIVE-PPE. That is 833-GIVE-PPE, or you can log it in our website, giveppe.ky.gov. And let me say, I'm so proud of you, Kentucky. My goodness, the number of people that have come together, that have provided these supplies. What you are doing is protecting our frontline workers. I've been so proud of you, but I know there is so much more. I got a text from a friend today who runs a chocolate company that just delivered almost 200,000 gloves. I know that there are others out there. I know that this opportunity is here. We need all of this. I mean, this is when it is needed the most. So please, if you have PPE, again, that falls into any of those categories, and I'm going to start showing a slide of what some of it is. Make sure that you get it to us through these ways. Also, just want to take a minute. We've thanked other folks out there, to thank the folks at St. E's in Northern Kentucky, doing a lot to increase their healthcare capacity, doing a whole lot to spread the message in Northern Kentucky, doing a whole lot to motivate their community to give PPE. I've talked about a number of other hospital systems, never had the opportunity to bring them up, but do appreciate the things that they are doing. The other way that if you have PPE on hand and you want to get it to us is we are accepting it at all 16 Kentucky State Police posts across the state and at our Transportation Cabinet district offices in Louisville and Lexington. These are really easy ways. You can call us, you can go to the website, you can drop it off. I believe we have millions upon millions of pieces of PPE that are out there in Kentucky. And again, this is the one we can control. We can't control what we can ultimately procure. We can try. We can continue to try, and we are. But if the federal government buys it, there's very little we can do. We can work to manufacture it. There are some limitations there. But the one thing, Kentucky, that is entirely in our control that we can knock out of the park is what we donate and what we have on hand. Also want to give an update on nursing facilities. I believe that question was asked the other day. It is a question about the types of checks that we're doing on them. If you could pull that slide up, James. Right now, only complaints that have the potential of rising to an immediate jeopardy level are being surveyed. Our certification surveys have been paused because we want to make sure that our inspectors are not bringing the coronavirus to the facility. Anytime we are in one of these facilities, we are conducting a focused infection control survey. Yesterday, we have been asked by the federal government for specific coronavirus isolated units within these facilities, and we are working with them right now. We currently have 4 of them in facilities and are working on more. Now, this is why it's really important that we have limited the type of visitation that we're allowing, and it's why we're also limiting some of the inspections that we would otherwise like to do. It's that we have 6 nursing homes with positive residents and 3 with positive staffs. We want to prevent the coronavirus from reaching our nursing homes, and when it does, from spreading through them. This is an area where people are very susceptible, and we want to make sure that we protect them the best that we can. So that is our nursing home update. All right, now to today's results. Today, and again, it's hard to think of something like this as good news, but we have 90 new cases. That brings us to a total of 831, and that is the official state number. The reason that I say is that is somewhat positive news is that we are not escalating every day or every other day right now, though we will escalate larger in the way that many other states do. I believe that that's directly attributable to the steps that you are taking, to your hard work. That is us helping to flatten that curve. And even though we are still in the increase and in the escalation that we have no matter what, I believe that when we see these numbers, it means that you are making a difference. So no one wants 90 new cases, but 90 will become a small number moving into the future until we start having the decrease once we've hit our peak. So I hope, while 90 is hard to swallow, that you hear that the fact that we have less than we had yesterday or the day before or close to it, is better news at least than many states are having. This number breaks down to 26 in Jefferson, 13 we can't confirm at the moment the official county, 8 in Boyd, 4 in Boyle, 4 in Fayette, 4 in Kenton, 2 in Adair, Bullitt, Campbell, and Franklin, Henderson, and Scott, and 1 in Allen, Anderson, Caldwell, Callaway, Carter, Christian, Clark, Davis, Edmondson, Graves, Greenup, Hardin, Jessamine, Madison, Mason, Montgomery, Oldham, Russell, and Johnson. There's some new counties in there. And folks, if this is the first one you've heard in your county, again, just breathe. It's been there. It is in every county. We are to the point now where we know this coronavirus is all throughout the state, and we all ought to do the things both to protect ourselves and to keep it from spreading, which is being healthy at home. Healthy at home is the number one thing you can do to protect yourself, to protect those that are most vulnerable, and to protect our frontline healthcare workers. We're counting on you. That's your duty, healthy at home. Yesterday, we had our toughest day yet. when we lost 11 Kentuckians. Today we've lost 6. And these are 6 Kentuckians that we will miss. These are 6 losses to all of us, whether we know these families or not. So we want to light our homes up, our neighborhoods up, our facilities up green again tonight to show compassion for these families and also know that there is a better day coming and that renewal is not just for us, it's also for those individuals we've lost as their soul moves from their body to a better place. The 6 are a 60-year-old female from Jefferson, an 86-year-old female from Madison, an 88-year-old female from Jefferson, a 64-year-old male from Jefferson, 69-year-old male from Jefferson, and a 76-year-old female from Hopkins. And these numbers will be a little different at different times than what the mayor of Louisville gives out. We have different cutoffs, but we are coordinating, and we believe, each day when we go through them, that they are accurate. So 6 new Kentuckians. So let's remember on this beautiful weekend that in just the last 2 days we've lost 17 individuals, that our actions have consequences. And the way I just mentioned that, you hear the negative consequences. I want you to hear the positive consequences. Your choices, if that model we showed today was correct, and again, we're all guessing, your choices could save 11,000 people. Think about that. How many of us have ever had the opportunity, simply by making the right choices and stay at home, to save up to 11,000 people? When I say it's your duty or it's even heroic to be healthy at home, it is. It is. It means you're doing what it takes to protect those around you, and I need your best. I need your best in April. I may need your best in May. Right now, I need your best in April. And what you do truly matters. A couple other numbers. Give you the happier number. 228 folks have fully recovered, and that's just what we can confirm now. We believe it's significantly more, but these are folks that have fully come through this and are out the other side. And we can confirm, though we still believe the number is larger, but we can confirm that we have had 15,572 people tested in Kentucky. Again, we are still going through an audit to make sure that we can go out there and find all of those negative tests that aren't always reported. And just to give you a reminder about how many different ways that tests come in, I just want to show you what we went through yesterday. Yesterday, when we did it at the time, we had 32 different labs that all send information directly to Stephen Stack, to the Department of Public Health. So those are 32. Some of those labs didn't exist, or none of those labs did COVID testing before this. So there's challenges in that data. We also get information sometimes, not from the labs, but from the local health departments, and we certainly get information on the positive from them. Sometimes it's the news media that we get it from, and sometimes it's hospitals that are doing the tests directly that are the first time that we hear from them. So again, we do the very best we can with the data, and the very best is all any of us can do as we get through this. I did have a question the other day about sharing stories about people that we lost, and we ought to do that going forward if we have the permission of the family. But it was right in that these numbers can sometimes get impersonal. Let's just remember that they are real people, that it's families. When we announce 90 new cases, it's 90 families that are worried about that person. It's probably 90 people that are worried that they've spread it to other people, and at this point, don't be. This is going around the community. You've done the best that you can. Just do everything you can to get better. If you've got the coronavirus and are trying to recover right now, we're with you. We want you to get better. We want to pump up that number of people that have fully recovered, and we are with you. But everybody that we've lost and our numbers that will increase are real, special, important people, children of God, and let's make sure we don't just let this become a numbers game. And that's hard on me, just like it's hard on you, because I read them out each and every day. So in an effort to hopefully get you all out a little bit earlier today, we'll move to questions. We'll do 10 to 15 minutes, and we'll go both from the three reporters that we have here today, who are Joe Sonka, Phil Pendleton, and Mike Valente. And we'll go in the opposite order this time that we started yesterday. So, Joe.
Even though this week you've hired more people to process all of those unemployment insurance claims on the website and on the phone, we're still hearing from people that this is bogged down. Are there any additional steps you're considering to take to make that easier for people?
The question is, even with all the people that we've hired, the unemployment claims are still going slow and still getting bogged down. Are there additional steps that we're taking? Yes, we're hiring more people. We are getting more servers. And every single person that's making that complaint is 100% right. Now, they shouldn't have to wait. They're going through way too much. They're anxious, and I'm anxious to get them the benefits that they need. Some of them have been waiting. Some of them who were independent contractors had to wait until between when I put out the order, when they had a steady income coming in, and when we could open up eligibility. Again, I'd just say stick with us. We are trying to expand our capacity, and we can't expand our capacity nearly as fast as all the claims that are coming in. I know we had a couple of really good days, but our goal is to get everybody covered. And remember, there are just lots of people out there that are applying. I'll have Josh Benton at the next one. I gave him the night off to be with his family, but we will continue to do. I'm not going to say to ask them to do better. This is on me. I'm going to continue to do better to make sure that we can get you that yes that much faster. And to folks out there, I believe the yes is coming for you. I do. With the way that we've expanded eligibility, I believe almost all of you should qualify, and we want to get you signed up. Try to give us time. I understand if you're frustrated, and we'll work with you, and we'll make sure that we get it done. I have a question. As the governor received House Bill 351, I think that's referencing the budget, which is 352, but 351 is one of the revenue bills. I have received it. We are reviewing it. As a governor with the budget, you get the power of line item veto, so it's going to take a number of days to fully review it. What I can say is any section that limits flexibility and having the funds to use to fight this coronavirus is one thing that I will absolutely line item veto. There is also a section in there that's never been in there before on use of restricted funds that would grind a whole lot of government to almost a halt, and that's even before the coronavirus hit us. We tried to explain that to the folks drafting it. They still put it in. Absolutely going to veto that piece as well. Regarding prisoners released, how self-quarantine will be enforced. Well, it's a part of the order, but we won't have ankle monitors because at that point we have made a commutation. How can we make sure that law-abiding citizens stay safe as the inmates are released? Well, like everybody else, they're going to be healthy at home. They have to have an address. The same orders that apply to people staying away from crowds, meaning other people, apply to them as well. They are going to have to go through and not a full physical, but a medical check before they are released. We're doing this to protect them, but look at who we're releasing as well in this first group. It is nonviolent, non-sex offenders. So I believe, Kentucky, that you are safe, that have less than 6 months on their sentence. And it's also folks that are medically vulnerable to this virus. They are the two lowest class felonies. This is just a step that we believe we need to take to ultimately protect those that are incarcerated. And we may make additional steps as we move forward. It says during previous commutations, inmates thought they were being pardoned. They are not. This is just commuting the end part of their sentence. It will still be on the record. If they commit a new crime based on the executive order, they can be required to serve out the rest of that time, and it would at the very least come into play in sentencing for any future crime. Phil?
There's been a lot said about whether or not the public should be wearing masks. I guess primarily to keep the disease from spreading from you to someone else. What do you think about that?
The question is on whether the public should be wearing masks. The CDC is considering, maybe even reconsidering that right now. and we're awaiting what they're going to advise to us. They have advised repeatedly, over and over and over, that if you are healthy and you shouldn't be wearing a mask in public. There's now at least news reports that that's being reconsidered. I don't know how much that's being reconsidered now, but when we get that advice, we will suggest that people follow that advice, however it is. Certainly, if you are sick whatsoever, in any way, form, or fashion, you ought to be wearing it. Now, you shouldn't be out of your house if you're sick. You shouldn't be going out and around people, but inside your house, if you're sick, you ought to be wearing a mask. Now, if we reach the point where people are being told you may be a little safer wearing masks in public, and I think what that mainly means is in buildings where the public would come together, maybe when you go to the grocery store, do not try to get these N95 masks that our healthcare officials desperately need. Any type of mask that will be suggested will be the cloth type that preserves what our frontline folks need. I mean, any recommendation that comes out from the CDC will be based on a possibility, probably not even a probability of the spread of the virus. Remember, the healthcare workers are treating people with this virus. They need the very best PPE, and we need to make sure, even if we move in that direction, that we can serve that the best way we can. Any updates on drive-through testing? Well, I've told you on other days we've taken 2 steps forward and 1 step back. We have taken probably 2 steps back and a half a step forward on that. We are awaiting our partners that we hope to get this through to have sufficient supplies. This is not unique to them. This is in just about every endeavor that we do, that we are ready. We get up to the line, and the shipment of PPE or test kits, same thing every other state is facing, don't come in or aren't sufficient enough to do it. Our half step forward is, I hope, this weekend we will have an announcement about testing and our testing capacity. Again, I want to make sure that it is solid before we do it. The most important thing that we do isn't just have drive-through testing because it looks neat when you have the cameras there. It's to increase our testing capacity as much as we can throughout Kentucky in a way those that need it the most get it. Are there any communities and areas of the state that I feel are not getting enough information, and more importantly, correct information, that you'd like those of us in the media to pay more attention to? I think it's certainly every area in Kentucky, but I tell you what, every county, and I don't think we have our map from the internet, every county that doesn't have a confirmed case is a place where we need more attention from the media, spreading the word that you have plenty of cases. Every area, if we put up a map that isn't in a color or is in the lightest color, you do have more cases. And so those are the areas that we would ask, especially the local media, the local radio stations, do twice as many PSAs on social distancing, do twice as much, because it creates a false sense of security when you think that your county doesn't have a positive case. Mike?
In your statement explaining why you vetoed Senate Bill 2 today, you cited concerns surrounding COVID-19 and said that, or suggested that people would run into obstacles to obtain identification. If this bill becomes law, if they override the veto, how would you suggest people go about trying to break down those barriers?
The question is on what's called Senate Bill 2, which is a bill that I vetoed today. It is the bill that would require individuals to have a photo ID to vote. Well, right now, with the coronavirus, every place that you would go to get a photo ID is closed to in-person traffic. No way you're going to go in there. No way you're going to get a photo. We don't know when they're going to reopen. We're talking about the primary being by mail-in. We believe there might be a spike in the coronavirus again in the fall. That's when we show the St. Louis map and say we got to get it right the first time. And the fact that somebody would need something, even though the bill goes into effect a little later, but the fact that someone would need something to vote that right now they absolutely can't get because of the coronavirus, yes, I think is a wrong move and absolutely needed to be vetoed. And our Secretary of State pushed this bill. He has his reasons. He's considering, and we're considering, whether or not we might have to have a mail-in vote. Well, what does this bill do with that? How do you present a photo ID if that's the case. This is, first of all, I'd be against this bill even if the coronavirus wasn't here. I want to be transparent about that. I think more people should vote. And I was the Attorney General for 4 years, and we never had one case of someone trying to impersonate another because they didn't have a photo ID. It didn't exist. We sat in that room with the FBI, with the state police, with other law enforcement. It just doesn't happen. So I would have been against it otherwise, but it's just not possible to implement right now in the midst of the coronavirus. I was contacted by the spouse of someone who works at Hitachi who is concerned that they are reopening some of the assembly lines Monday, but that Hitachi is not taking the steps to protect their employees. Have we been in contact with management? To my knowledge, this is the first complaint that we've received, but we will follow up on it. All right, on Thursday, the Kentucky Horse Racing Commission told the tracks it was unable to suggest a timeline for reopening of live racing in the state. Do I have a timeline in mind? Now, the answer to that is it's going to take as long to defeat this virus as it takes. Now, we're talking about some term of months, and we're not talking about some term of years. But the moment that we start trying to say that we believe it's X days away is the moment people start relaxing on the social distancing. We see the spike, and ultimately we lose more people because of it. The second part is with live racing taking place in some states that have a stay-at-home order in place, would you be willing to consider the state track's approval to run live racing without fans in the stand? Well, at least as long as we are seeing an escalation, you would still have groups of people that would have to come together to make that happen. It'd be the same thing as the NBA, which is being canceled right now. So while there might be a point, hopefully on when we see cases going down, where that's something that we could consider. Right now, we shouldn't be getting people together for any reason whatsoever. A Campbell County resident has sued the governor, that's me, claiming the executive order limiting travel to other states is unconstitutional. Has the governor reviewed the lawsuit, and can he comment on the claims? I haven't read it, I'm not worried about it, and we will win it. What is the timeline for launching the field hospital at Kentucky State Fairgrounds, and who will staff it? We are just now starting the process of making that conversion. We will provide more information as we go. Our hope is to have it completed long before it's needed, and we will be working on the staffing as we go, and understand that when the more that we expand, and this will be one of our largest rings of expansion as we look at how we expand out to get beds from 18,000 to 25,000. We will also be at that point working with certain licensed medical professionals, and then volunteers and others that will help us staff some of those. Joe.
You talked about the negative effects of the church services in Hopkins County and how many people contracted it. How many churches are you aware of that are still continuing to have services, and what do you plan to do about those churches that refuse the seats having those?
The question is, I talked about the church in Hopkins County, and let me first say, I wasn't trying to say anything negative about the people in Hopkins County, not at all. That's where my family's from. I even mentioned the town that my dad is from. It is a special place to me. It's actually the last stop I made, or the second last stop on all my campaigns. Even though it's a smaller town, it's something important to me. It isn't about the county, it's just where this took place. And I was actually mentioning it because it's devastated the county. Started with somebody from out of state. But the question is, how many other churches are we aware of that are still holding in-person services? Very few. They continue to diminish as the weeks go by. There was one here in Frankfort that was, but is no longer. In fact, I believe this week we busted 2 gyms in Frankfort that, despite the order, we're letting people in the back door. I know I say this a lot, but we can't be doing that. And so what I would recommend to any county judge or sheriff in a community where that's still going on is, if they won't voluntarily do it, at this point we ought to have a sheriff's deputy or a state police car in the parking lot, and as people walk by and through, I hope they're reminded that what they're doing is spreading the coronavirus beyond their church, beyond any meeting that they're at. This shouldn't just be churches. That it's going to go into the community, that it may impact the sheriff's deputy's office, EMS. It may knock out a whole wing at the hospital that's supposed to be treating people. And to any regular meeting of people that get together, congregation or otherwise, is it worth losing 5% of your church, 10% of your church? When you show back up for Christmas, do you want to look around and do you want to see an entire part of the pews that used to be filled that aren't? Now, this isn't a test of faith. This is our time to use the wisdom that God provides us to protect ourselves and one another, and watch the virtual service. I do each and every weekend. My kids are doing their handbells and doing choir with their church through Zoom. It's pretty neat to see. They don't sound quite as good as the Grease thing we played the other day, but they're not doing too bad. I have a concerned resident whose landlord is showing his apartment while he's still living there, opening his door to potential renters for appointments. That's not smart. That's just increasing the contacts that are there. You know, if you're showing an empty house or an empty apartment, you know, that's one thing, but I hope you're cleaning really well afterwards. But if somebody's living there right now, don't bring somebody else in when we're trying to engage in social distancing. Fourth employee, it says, is tested positive at the Amazon warehouse in Shepherdsville. I think that's one that we have to follow up on. We've been previously in communications with them. I was asked the mask question. I was asked the church question. How will the self-quarantine order for those traveling out of state be enforced? This is something, again, that is out there, that's an order. It's not a recommendation, but a lot of it will rely on people doing the right thing and on positive social pressure that is out there. We talked about inmates being screened for any symptoms before being released. They will not be released if they are showing any symptoms. Let me answer this one. Can the governor address reports that refrigerator trucks are being brought in the fairgrounds for temporary morgues? No. No. And everything we're doing right now is to try to make sure that we never hit where New York is right now. My heart goes out to them. I hope yours does too. You know, they're living through something that's very public and very visible and very devastating, and ought to motivate us to make sure that it doesn't happen here. Phil?
That model that you had a 3-month projection. Should we read into that we're going to be under these restrictions probably through the month of May?
The question was, the model we showed had a 3-month projection. Should we assume the restrictions will last through at least the end of May? They're certainly going to extend through the end of April. All of our models are based on the best data we have, but there's very little data. I mean, anywhere there's very little data. And so, you know, all of the graphs, you know, have the increase and then the decrease, whether or not it's severe or whether it's flattened. But we haven't seen the peak anywhere in the United States yet. And that's, I think, the only place that we're going to get the data. And we would need to see that. You know, if we don't see the peak in New York in the next couple of weeks, then we're probably going into May. And again, we ought to be ready if we've got to go all the way through May. Now, I will say this. If we're going through May, it's working. If it's going through May, we are definitely flattening the curve, and we are protecting people around us. If we're going through May, it means hopefully we're pushing towards the better social distancing models. And so, yes, if we have really great success, we may be at it a little bit longer. Now, when you look at the models, you don't necessarily have social distancing right until the very end. You know, as cases decrease and as more people who have had it in the community, you can at a point in the decrease slowly start easing restrictions because especially for those that are healthy, it helps to run that curve down. So we shouldn't assume that right to the very end of that curve we're doing all of those restrictions. And that's a fairly detailed answer, but the real answer is it's going to take as long as it's going to take. There is a specific question here about a Lyon County nursing home and about testing and about whether enough tests were done there. What I can say is we work with the public health departments in each and every one of those communities. We try to provide what tests we have, but remember the vast majority of tests that are out there right now are secured by the hospitals and the healthcare providers in other places. We are now a very small part of the testing that is going on in Kentucky, and we all want to get to the point. All want to get to the point where everybody who wants a test can get one, but we're not even there yet. We all want to get to the point where every time somebody tests positive, we can test everybody that's been in contact with them. We're not even there yet. And so it continues to be that test of strength and of humanity for us, especially those that are the healthiest, that you may even get symptoms of the coronavirus. And you may be asked, if you are healthy, to ride that out at home for those 2 weeks, and you may never even get a test on it. That's because that person who is really sick, and we need to know when their life is on the line, if we are treating the coronavirus versus something else that may be hurting them, needing to have that clarity there. Can you tell me how many tests the state has received to date? That's hard because we don't receive them directly. The best numbers we have now are the tests that have been done. That's reported to us. So if hospital system X gets a certain number of tests in, that's not a reportable number. The reportable number that we get every day is number of tests and number of positives. And so I hope folks are out there getting as many as they can. Are there preparations for physical construction of the field hospital underway? What is the expected date of completion? Who will staff it? These are all questions we answered. We're going to build out as fast as we can. What it'll look like will depend on how much time we have. We hope to have it fully done in the best shape and locked up in a way that we can activate it at any time. But if this escalates faster, we're going to make sure that we have enough of the guts of the facility in place to use it when we need to. What are the guidances, recommendations, or orders related to farmers markets? CDC guidelines. This is something like golf, to where if people can follow the rules, that we can still do it. It falls in an agriculture exception. It's a way that some people don't have to travel as far to get their stuff. But you gotta spread out. If they create crowds, we can't do them. Second, remember, you can't go to one if you're sick because you could be spreading it. And third, remember how this is transmitted. If you touch it, you buy it, right? You can't do what people have done in the past and pick something up and check it out and put it back down. You know, that's a way to spread the virus. So I don't mean to be creating new farmers market rules or new grocery store rules, but with the coronavirus out there, you know, just make sure you're real thoughtful. And that's all this is. Knowing that anything that you have, and you ought to act like you have this, that you can transmit it to another. So I guess my new farmers market rule is if you touch it, you buy it. And then we answered how many have recovered from the coronavirus. So Mike?
Governor, the FDA has authorized its first coronavirus antibody test, and obviously that could be really significant for people who want to donate plasma to those who are struggling with coronavirus. And I guess this is a two-part question. First off, do you know how widespread that will be in Kentucky? And also, can people who suspect they had symptoms of COVID-19 but were never diagnosed, can those people get the test as well?
Okay, these are good questions, and we'll probably have to get some clarity on them. It's the FDA recently coming up with their first antibody, first tests, trying to test if people's plasma that have had the coronavirus can be used to treat other people. And I believe it's Baptist that is working on one of these pilots as well. We're in communication with them. We want to see what the science is. Certainly, if it turns out to be effective, and you want to make sure that it's effective before you go too far, then yes, we will be asking a lot of the people that have had the coronavirus. Just like if those that have had the coronavirus have immunity, and we don't know that yet, then we're going to be asking a lot of them too. I'll talk about often this being the challenge of our times. We're going to ask a lot of a lot of people out there, and I know that they're willing to answer the call. Just think about the med students, the nursing students, and others that, knowing what we're dealing with, and it's scary, it creates anxiety, have signed up almost to a person, to a student, to help out, knowing that they are healthy, knowing that they'll get through it, but knowing that they can help other people. All right, we've gone just a little bit over. You have one more? All right.
So, Jared, Kushner made comments yesterday about the federal stockpile of medical equipment not belonging to the states. Wondered if you wanted to comment on that and how those calls with governors in the White House have been going on that issue.
So the question is Jared Kushner making a remark about the federal stockpile not belonging to states. I haven't heard that. I wish we could get more from the federal stockpile. My concern is less about the federal stockpile than when I try to go out and buy something and it never shows up because the federal government has bought it out from under us. I'm not alone in that. Every other state is dealing with it. It's not a great system, but it's really hard to build a new system on the fly. All I ask for is the ability to better protect my people, our people here in Kentucky, and when we have an order that's confirmed, not having it bought out from under us. All right, folks, it's Friday afternoon. It's Friday afternoon. The weather's beautiful, and it's going to be beautiful all weekend. I want you to get out and enjoy it, but only if you can do it without creating a crowd or going to a crowd. The stakes are real. We showed a model today where our actions could be the difference in the lives of 11,000 people. But I trust you. You've shown me that you are willing to believe and to buy in. So, and I've read messages from many of you that have lost your jobs, and you are still committed and bought in. You know that your sacrifice is going to help other people, and that is truly amazing. For every one example that we have of somebody doing the wrong thing, we have hundreds of thousands of examples of people doing the right thing. So let's continue to lift each other up. Let's continue to use all of our electronic means to touch base with people because we don't want them to be isolated. Let's make sure that we get out there and model the right type of behavior, because how well we do this social distance will determine the losses we suffer here in Kentucky. So I made a challenge to every single member of the media, especially with this beautiful weekend coming up, to create their own PSAs, their own message, their own ways to tell people that this is real, and we need to make sure that we follow the recommendations. The one I'm going to show today, I'm going to show more as we go forward, is from a reporter named Mark Vanderhoff. Mark included his family and included a slide, and that, of course, won the day. Have a good weekend. Engage in social distancing. We will get through this, and we will get through it together. Thank you, Virginia.
I'm Mark Vanderhoff, and when I'm not reporting for WLKY News, I like to go out for walks with my family. It's nice to get some fresh air and get some exercise. But even when you're outside, it's important to follow some social distancing guidelines. Chase, pull up that slide. Now, in this slide, you can see people maintaining 6 feet on all sides, except for that one instance circled there in yellow. Now, we can't be doing that. Hikers, bikers, runners, dog walkers, everybody enjoying springtime in Kentucky. Do your part to prevent the spread. Stay 6 feet apart and avoid crowded areas.
Crystal?
So what you should do is speak to the people from the previous administration, Jim, and ask them that question, because the shelves were empty. And you know what else? The military shelves were also empty. We had no ammunition, literally, and that was said by one of your favorite generals. We have no ammunition. Guess what? We had very little medical supply also. All right. Go ahead. We'll get it back. We'll get you back. We'll get you back, please.
What about that question?
Jim, I said we'll get you back. Please, go ahead.
So I wanted to ask about the DPA. So you said that there will be a ban on exporting of all, what does it cover? So masks, gloves, what else is
Covers
included in that
everything.
order? And are you concerned?
But if somebody ordered, if Italy, if Spain, who has big problems, these are countries with tremendous problems, France, if they have long-term orders and they're in there and they want to get certain things, I've let them go out in certain instances because I think it's only fair. They have problems that are proportionately or relatively bigger than our problems. So if they ordered something and they're waiting for, as an example, masks made here and going to Italy, I'm not going to be stopping that. I think it would be very unfair. And by the way, speaking about being fair and unfair, two very big cruise liners, as you know, I allowed them to dock today. We worked with the governor of Florida, as you know, Ron DeSantis, and we worked on it, and we had tremendous security, and we took the sick people, and we're working with them. We have doctors. We have great doctors, military doctors. And from a humane standpoint, not that we're in love with this. These are two massive ships, but we have to take care of people. We have to take care. We sent many back to Canada. The Canadians came and worked very closely with us, as did the UK. We had a lot of people from the UK, and we took care of the Americans. We took care of the sick. We had some people very sick. I think we have 3 to 4, maybe 5 people that had died on the boat, one of the boats actually, and we had to take care of these people. So we could have let them float aimlessly into the ocean looking for port, as they've been doing for a long time. And I made the decision we had to take them in, and Homeland Security and a lot of other people did a great job. But we had to help people. These are people that were very, very sick. Some were dying, some died. Please.
Can I just finish, please?
Go ahead, yeah, go ahead.
Mr. President, your staff today said that people in close proximity to you and the Vice President will get a coronavirus test. I'm wondering, are you concerned that the people you've been hanging around with may have the virus?
No, I'm not concerned, no. I had a test yesterday.
But what's the reason for the order for people who meet with you or talk to you? Why?
I don't know.
should
I
they
mean,
require testing?
I heard from the oil executives, these are people, most of them had not had the test, and frankly, I think